It is very good to be with you. I am very pleased to congratulate COHRED on its 20th anniversary, and I feel a sense of kinship having been involved with the World Development Report, which is also celebrating its 20th anniversary this year. 20th anniversaries are not moments when one has a sense of initiation that things have just begun, but certainly they're a long way from the end. And that's certainly true here in the global health area, where the ideas that COHRED has developed over its 20 years, the work that the World Development Report did on global health 20 years ago, has had substantial impact over time. But one very much hopes at a 20th wedding anniversary that the best years are ahead. And certainly my hope is that the best years for COHRED and the best years for some of the ideas and visions contained in the World Development Report lie in the future. Why, you might ask, is an economist like me, known, if anything, more for work in macroeconomics and finance, for work on financial crises and the like, speaking to a global health conference and speaking with you? It's a question that I sometimes wonder about, and certainly I suspect on some of the main questions here, everyone listening to this video knows more about them than I do. But one of the things that I am proudest to have done in my career was a decision that I took at the end of 1991 during a time when I was the chief economist of the World Bank. The World Bank each year publishes a World Development Report. A little bit of that World Development Report is a commentary on the events of the last year and economic forecasts for various countries. But the more interesting and important part is that the bank uses that document each year to make what it hopes will be an important intellectual statement on a broad area within the study of economic development. The responsibility falls to the chief economist to choose, with the approval of the president of the bank, what the topic of that report will be, and to select a team that will carry out the research and writing that goes into the World Development Report. At that time, the Washington Consensus was perhaps at its zenith. The bank had been a powerful and in many ways useful voice for a set of ideas around deregulation, disinflation, divestiture of public enterprises. The bank had been a strong force pushing for market-oriented policies. In the wake of the collapse of the Soviet Union and the transition to a market economy in Central Europe, there was a great deal of emphasis on pro-market themes. I believed that it was important at that moment to reassert the centrality for human welfare of things that governments did and things that could not be left to standard market forces. And that led me to be attracted to the idea of a report addressing healthcare questions. When I learned a little bit more about the set of issues involved with global health, I came to see two other things. I came to see that there were profound developments underway in the life sciences that suggested that the time was ripe for a major attack on global disease. that resources committed to scientific research had enormous potential in a way they had not had previously because of breakthroughs in basic science. And I also came to see that the world was substantially underinvesting in those kinds of research. It was asserted at one point, and I don't know whether this is exactly right, but the assertion certainly got my attention, that the major global pharmaceutical companies spent more each year on pet disease than they did on tropical disease. And that seemed a travesty and the kind of issue that a global institution like the World Bank ought to be in a position to address. It also seemed to me that along with revolutions in science, there were revolutions underway in social science that pointed towards the possibility of substantial improvements in the efficacy of healthcare interventions. Those had to do with what one might call the mainstreaming of cost-benefit analysis. Cost-benefit analysis was moving from an abstract ideal favored by economists to a practical policy tool that could be used in actual applications. And certainly the data that was necessary to do cost-benefit analyses, to bring rigor to the allocation of healthcare resources, was very much becoming available at that time with the global burden of disease work. All of that together made it in the end an easy decision for me to decide that the World Bank should commit itself to a report on global health. I had one other proposition in my mind as I commissioned the report and as I made another wise choice to select Dean Jamieson as its leader. And that is that in speaking and arguing and writing about public policy, one has rarely said something meaningful if it's impossible to disagree with what one has said. That propositions of the form, there are important interactions between policy areas, or propositions of the form, policy needs to be attentive to the country context, are unlikely to generate controversy, but that lack of controversy is in part a reflection of the fact that they're not highly contentful. Certainly we who were involved with the World Development Report in 1993 respected this admonition, and there's much that is found in the report that has generated controversy in subsequent years. That is part of the reason why I am pleased to be working with Dean to chair a commission that is taking stock of where things are 20 years after the initial Global World Development Report on global health. And certainly there are areas where 20 more years of experience and 20 more years of subsequent research have changed our minds, and where the advice one would give is not precisely the advice one would have given 20 years ago. But one area where that is not true is with respect to the work that you are focused on. WDR 1993 concluded, and I quote, "Increased scientific knowledge has accounted for much of the dramatic improvement in health that has occurred in this century. By providing information that forms the basis of household and government action, and by underpinning the development of preventive, curative, and diagnostic technologies. Investment in continued scientific advance will amplify the effectiveness of each element of the approach proposed in this report. Because the fruits of science benefit all countries, internationally collaborative efforts, of which there are several excellent examples, will often be the right way to proceed." Those words were true 20 years ago, and I believe they are more true today. And I believe this kind of perspective represents a kind of foundation for the discussions that you will be having at your colloquium. There are three questions as I think about our commission and its broad remit, and as I think about the importance of scientific research for global health, that seem particularly salient to me, and where I will be particularly interested in learning the results of your deliberations. First, to what extent do we need new tools to reach an end game by 2040? By an end game, I mean a situation that would really represent a milestone for humanity 2.5 centuries after the beginning of the Industrial Revolution. A situation in which the burden of avertible infectious, reproductive, and maternal and child deaths in high mortality countries reaches those of the industrialized OECD. Is it a matter of disseminating existing tools more fully? Is it a matter simply of resourcing existing systems? Or, as I suspect, will we require some new tools over the next 25 years? And if we do require new tools, recognizing the enormous externalities that are associated with the development of a new tool where whoever develops it can capture only a very small portion of the benefits, are there adequate financing and incentive mechanisms in place to develop those new tools? Second question. With respect to non-communicable diseases, there is a huge volume of private and public R&D investment now underway in high-income countries. It is probably inconceivable that any initiative focused on research, particularly scientific research, directed at NCDs in low and middle income countries would provide resources nearly as large as what is being invested currently. Is it nonetheless worth making the effort? Peter Piot argues very strongly that such research is necessary. He notes that it can result in benefits by permitting the replication and extending of findings, possibly discovering new causes of non-communicable diseases, studying exposure levels or situations or possible contaminants that are rare in high-income countries, and that there may be important linkages with infectious diseases that one would miss studying high-income countries. What kind of research program would best focus in these areas? How should that need be balanced against other needs for resources directed at lower and middle income countries? That is an additional question that the progress we have made in the last 20 years makes pressing today. A third question is of a rather different kind. It is, I think, all but self-evident that even the best delivery system, even the most efficient organization, even the most compassionate care will come to little unless science has provided the underlying understanding that makes possible prevention or cure. But to suggest the necessity of a scientific basis, if there is to be efficacy, is not to suggest the sufficiency of scientific understanding. Questions of implementation loom large. I look, for example, at my own country, where the scientific basis for treatment is the same in every county, but where life expectancies differ by as much as 30 years between some of the most fortunate and some of the least fortunate counties in our country. Some of that, perhaps the vast majority of it, does not involve the healthcare system, but involves issues outside the healthcare system, many aggravated for those of low socioeconomic status. But some of it does involve the healthcare system, and it raises the question of whether implementation science holds positive prospects. Now, I have always been slightly of the suspicion that fields that have to call themselves science are not. Cognitive science, political science, Christian science. And so when I hear the phrase implementation science, it's with a certain suspicion. On the other hand, anyone who has seen different organizations function, or as I have been privileged to see different parts of the same organization function with radically different effectiveness, has to find the challenge of generating the best possible outcomes to be a very exciting and important one. So what is our way forward on these questions of implementation? That is a third area where I think your deliberations will be very, very important. Congratulations on your 20th anniversary. I'm very sorry that I'm not able to be with you in person, and I know I am one of many who looks forward very much to the results of this conference. Thank you.